Hello everyone, welcome to our Thursday webinar. Today we're talking with Varsha regarding molecular diagnostic testing. So I'm going to turn over to Varsha. Go ahead and educate us.
All right. So hello everybody, this is Varsha. I have Dr. Chris Duke as well with me with this webinar. So all we are doing here is giving you a brief idea about some of the new tests that we have developed recently. And at the same time, we also want to discuss some of the old tests, not old tests, but some tests which we haven't given you enough information about. So I will start with the, yeah. Okay, so most of the tests that we have developed, they are basically to predict the genetic diseases. So you know that genetic diseases are the diseases which can be passed from parents to their kids. So if you have any specific mutation, they can be passed from the parents to their kids. So all the tests that we have developed are based on prediction of such genetic diseases. So here is the list of some of the new tests, and there is a recap of some old tests as well. So HFE, which is the test which predicts hereditary hemochromatosis, factor V laden, which is blood clotting disorder, and factor 2 is also the same. And MTHFR you already know, and BRCA is you already know. So now let's start with HFE genotyping. HFE is a gene which actually regulates iron absorption in the body. So if HFE is defective, what happens is you end up accumulating lot of iron in the body. And excess of iron in the body is not good. It can lead to damage of some of the organ. As you can see in this image, excess of iron in liver can cause liver cirrhosis, cancer, and liver failure as well. Excess of iron in pancreas can lead to diabetes. Excess of iron in heart can lead to arrhythmia or heart failure. Similarly, excess of iron can also lead to arthritis or joint pain. And actually, if iron is accumulated in the skin, it can lead to a weird skin discoloration. This hemochromatosis is common in Northern European descent people, and so if they go for HFE genotyping test, they already know their risk associated, so they can take preventive action beforehand, and then they can avoid the damage that they can have with this disease. So who should be tested for HFE genotyping? As per the recommendation, not everybody is recommended for HFE genotyping. Only those who have excess of blood iron levels are recommended for HFE genotyping. And as you can see, those who have elevated serum ferritin level or elevated serum iron transferrin saturation. And these both tests are offered by Castle Medical. So that's why actually we have designed this test, because since we already have these two tests in Castle blood chemistry test list, then whenever we'll see a patient which has a abnormally high level of ferritin or iron transferrin, we can reflex them here for HFE test as well. So that's why we have designed this test. So in this case, ferritin and transferrin are iron binding protein which are present in our body. If you have excess of them, which tells you that you have excess of iron in your body. Other than that, people who have hereditary, like they have family history of HFE associated hereditary hemochromatosis, they are also recommended for such tests. Now this is a flow chart representing who should go for this test. Like again, I will just tell you the same thing. Person, if he has a family history of hemochromatosis, he should go for this test. Similarly, a patient who has elevated level of iron transferrin more than 50% or elevated serum ferritin more than 300 mg per liter should go for HFE genotyping. And if HFE genotyping comes positive, then physician orders liver biopsy to see whether liver has a lot of iron accumulated. Actually, there is no as such treatment for hemochromatosis. The only treatment option is phlebotomy, like donation of blood. So if person is diagnosed with hemochromatosis, physician will decide how much and how frequent blood has to be removed based on the symptoms of the person. And if HFE genotyping comes negative, then they will do some other associated tests to see what's going on in the body. So now the next thing is what other information you should have about HFE test, like what specimen type, what other information we need, what is the turnaround time, and what will lead to delay or rejection of the test. So specimen type is again the same. It's the blue cap buccal swab that we have been using for all other tests. Make sure patient does follow the instructions given together with the collection kits, and make sure those kits are not refrigerated or they are not frozen. And in this test, we also accept blood sample. Blood samples should be in purple cap tube. They should not be frozen as well. So, and apart from that, you know, we need Castle Medical Molecular Diagnostic Requisition Form. We need consent form signed by patient as well as healthcare provider. This test turnaround time will be 48 hours. But if there is some problem like wrong specimen received or poorly collected specimen received or maybe poorly stored sample received, like some frozen blood received, or incomplete requisition, then it will cause delay or sometimes rejection. Coming to my next test, which is called factor V and factor II genotyping. See, this red thing is our blood vessel. When there is any injury, our blood generates a clot, which leads to, which tries to stop excess of bleeding, right? So factor V and factor II are proteins which assist in blood clotting formation, which is good for us so that we avoid excess bleeding if there is a damage or injury. But when these factor V and factor II are mutated, in that case, we end up leading excessive blood clot formation in our body. Like as you can see, excessive blood clot formation in the leg vein can lead to deep vein thrombosis, which will lead to swelling, pain, as well as immobility. Sometimes what happens, these blood clots can travel across the body and get stuck in some other organs, like in lungs, and which is called pulmonary embolism. And these secondary clots can damage lung, heart, sometimes brain, which can lead to heart attack, stroke. And if they get stuck in one of the artery where which is going to fetus while a person is pregnant, then it can lead to pregnancy complication like stillbirth or high blood pressure or even complication in pregnancy. So now factor V lead-in. Factor V lead-in is the most common cause of deep vein thrombosis. Now in the small table you see, when factor V mutation results is GG, it means you have normal risk. It's a normal result. You have average risk of developing deep vein thrombosis. When you have GA, it means one copy is mutated, then it means you have 5 to 7-fold higher risk of developing deep vein thrombosis. If you have both the copies mutated, which is AA, then you have 25 to 50-fold higher than normal risk. And by the way, these data came from American Heart Association. Other than that, other than factor V mutation, there are some other factors which are also involved in developing deep vein thrombosis. And when these factors coexist together with factor V lead-in mutation, they worsen the case. Like for example, if a woman is under oral contraceptive, her risk of developing deep vein thrombosis without factor V mutation is already 3 to 4-fold higher than normal average people. And when there is a factor V lesion present, her risk increases to 35-fold. Similarly, people who are on hormone replacement therapy, their risk is already higher than average, which increases further if they have factor V lesion. Apart from that, homocysteine, high level of homocysteine, obesity, pregnancy, factor II mutation also are contributing factors for deep vein thrombosis. The reason why I have marked elevated homocysteine, because I have already talked about homocysteine previously, and I will also talk again in the next slides. Homocysteine is actually a toxic metabolite which accumulates in our body when you have a defective MTHFR in your body. And we have MTHFR test in our in Castle. At the same time, we have homocysteine test as in Castle as well. So let me give you, okay. So now coming to factor II. Factor II is second most common cause of deep vein thrombosis. Its another name is prothrombin, PT. There are many more names of factor II. It's factor V is more common. Factor II is less common, but still there are 2 to 5% people, Caucasian and some African descent people who have this mutation in factor II as well. And mutation in factor II also increases the risk of thrombosis by around 2 to 4. Now, who should be tested for factor V and factor II? Again, not everybody is recommended. As per American College of Medical Genetics, ACMG guidelines, only those who have family history or personal history of venous thrombosis should be tested. Like there can be different personal histories, like venous thrombosis at before the age of 50, venous thrombosis at unusual sites, venous thrombosis coming again and again, or venous thrombosis in pregnant women, or venous thrombosis or a person who has a history, who has a family history of thrombotic diseases, and maybe women who has a recurrent pregnancy loss or some pregnancy complications. These people are recommended to go for factor V and factor II. Now, some other information about factor V, factor II. So what specimen you need, what turnaround time, what criteria. It's again the same as HFE had. All the specimen requirement is same, turnaround time is same, and criteria for rejection is same. Now coming to our next test that we have already talked about, and you know about this test, but I would like to give you a recap just because all the tests that I'm discussing, they are connected to each other somehow. And the reason we developed all these tests are all related to blood chemistry somehow, like either blood iron level or blood clotting disorder. So since we started blood chemistry tests in toxicology lab, we thought of developing all these tests so that we can have the patient, if they are having abnormal result in blood chemistry, they can go for DNA test as well. So now coming to MTHFR. MTHFR is an enzyme which plays role in metabolism of vitamin 2 and folate. So let's say when you take folate, the dietary folate or supplement folate, it needs to be converted into a useful form of folate, which MTHFR does. If MTHFR is defective, your folate is not the conversion will slow down. So you will end up having less folate. At the same time, you have less folate, but body also builds up some toxic metabolite, which is called homocysteine, which I talked about in my previous slides. This toxic homocysteine can lead to several disorders like cardiovascular disorder, psychotropic disorders, cancer, pregnancy complications. So, and we have in Castle homocysteine test in toxicology lab already, which is done in blood. And there are specific requirements for that blood collection. Patient needs to be fasting for almost 10 hours before giving blood for homocysteine test. Here is another pictorial representation of how MTHFR works. Let's say this lady has a defective MTHFR. It means she has less useful folate. So it means she is at risk of heart disease, she has risk of blood clotting disorder, and as well as pregnancy complication. But at the same time, if the lady has defective MTHFR, but she knows that she has a defective MTHFR, then physician will prescribe proper supplements and proper diet. In that case, she will end up having normal levels of useful folate, and her risk will reduce down to develop all these disorders. Again, the same specimen requirement, turnaround time, and criteria is same. Except we have homocysteine test, which is a companion test of MTHFR, which is also available at Castle, and it is done in blood or urine samples. Now this is how our MTHFR report looks like. This is the first page. In the second page, we have all the frequently asked questions compiled about MTHFR, what it does, how we should, what is the treatment option. Everything is written in the second page, which I am not showing in the slides. Now coming to BRCA. So in oncology set, all the other tests that I described, they were basically related to cardiovascular, like blood clotting, blood iron. BRCA is the only test we have right now which is related to oncology. And I would love to have your suggestions, like we are right now developing more tests in the direction of oncology. I would love to have more suggestions from you. If you know there is a demand of some oncology tests, please feel free to give me all the suggestions so that I can work on developing those new tests. I already talked about BRCA, but let me give you a brief idea again. So in BRCA panel, we are testing BRCA1 and BRCA2 genes. These genes are actually tumor suppressor genes, but when they are mutated, the tumor suppressor effect is defective, and that's why it leads to breast and ovarian cancer. As you can see in this picture here, the gray bar represents breast cancer risk, percentage of breast cancer risk, and yellow bar represents risk of ovarian cancer. Women in general population have around 10% and less than 0.5% risk of breast and ovarian cancer. But if woman is positive for BRCA1, their risk increases by 60% for breast cancer and around 40% for ovarian cancer. Similarly, if woman is positive for BRCA2 mutation, their risk increases to about 45% for breast cancer and about 15% for ovarian cancer. So BRCA1, BRCA2 mutation plays a big role in breast and ovarian cancer. Now, not all the mutations can be like disease causing. Not all the mutations are bad. So when we get a sample, we sequence both BRCA1, BRCA2 gene, and we find out what mutations a person has. After we have the list of mutations, we sort them out whether there are any mutation which is disease causing or whether the mutations are all benign, non-disease causing. So mutations can be pathogenic, it means it is disease causing. It can be likely pathogenic. It means there is a 90% certainty that they are pathogenic, but there is not enough proof about it. The mutations can be uncertain significance. It means there are mutations, but still there is no study done about these uncertain significance mutation, and researchers are still working on it. Then the mutation can be benign. Benign means they are safe. These mutations are not going to cause any disease. And then mutation can be likely benign, which is like 90% certainty they are non-disease causing, but again, there is no enough proof about it. So mutations can be of all these categories, but in our report, we won't show benign mutation. We will show all the other 4 categories, but when there is a benign mutation, we don't show in the report because it's unnecessarily confusing. When there is benign, which is not going to cause any disease, then we just don't want to show, and just the report will say no pathogenic mutation found. That's it. That's how all the labs are doing. Now, how BRCA is inherited from parents to their kids. BRCA inheritance pattern is called autosomal dominant. It means, as I have previously discussed, every person has 2 copies of each gene. So even if there is one defective copy and the other copy is normal, it's still going to cause the disease. Now, as you can see in this picture here, the father is affected. The father has one copy of defective BRCA gene and mother is unaffected. In this case, their kids have 50% chance of getting this mutation. As you can see, like 50% of their kids have got this mutation. So this pattern is called autosomal dominant. Now again, who should be tested for BRCA? Not everybody is recommended, and actually insurance also not covered to any random person, only when there is a personal or family history or a woman is from any specific ethnic or racial background. These people are recommended to go for BRCA testing. Like a woman who had a breast cancer, or a woman had a personal history of ovarian cancer, or had a history of triple negative breast cancer, which is a very deadly form of breast cancer, actually, triple negative breast cancer. Or they have a family or personal history of male breast cancer, or a woman is from a specific ethnic background like Ashkenazi Jewish population, are recommended to go for BRCA testing. Or so these are the people who have been recommended to go for BRCA testing as per ACMG guidelines. Now, other information about BRCA test. BRCA test is little difficult to run. It's little different than the other four tests I mentioned. So for this test, the requirement is little different. Specimen, we need 2 tubes of whole blood sample in purple top tube. We need requisition form, that's true. We need consent form signed by patient and healthcare provider. At the same time, we need pre-certification authorization from patient's insurance company. These all things are required in order for us to start the process of running BRCA. And turnaround time is 25 days, starting from the day when we receive all the things. Because we cannot start the process unless we have any insurance information of the patient and all the other information that we are asking about. I know turnaround time sounds too much, but this is actually a complicated test, and I have seen most of the tests, including LabCorp also, they have similar turnaround time. We are working on reducing the turnaround time. It will only reduce down when we have enough sample volume. Now, criteria of rejection is pretty same. Like again, if you send me a wrong specimen, clotted blood, frozen blood, or completely wrong collection device, or saliva, or you don't send me a pre-cert authorization, then it will lead to delay and rejection of or maybe rejection of the test. This is how our report looks like for BRCA. As you can see, we will see, okay, in the summary, we'll see, okay, pathogenic mutation detected. Then we will describe the mutation, and in the paragraph, we will again describe what is the, about the mutation, what type of mutation it is, how it's going to cause BRCA, which will help physician decide what to do next. It's physician who will decide the risk, and maybe physician or genetic counselor. So after this, I'm done, and I would love to have any comment, suggestions, questions from you guys. Soon.
Yes, I'm here.
Yeah, does anybody has any question? I don't see anything.
I don't see anybody either. Again, everyone's currently muted, so if you would like to ask a question, please go ahead and unmute yourself. Oh, hang on 1 second. Someone just asked, is this presentation on the portal? It will be, Greg. It will be by end of day today. It'll be available on the portal for your review. As well, it's going to be the recorded webinar as well as the presentation. So you'll have it in both formats. Kim, good presentation. Thank you very much. Nick, can you make the sample report available in the portal? It probably already is. Under within the portal, there is a section, I believe it's under, if Dan's not on the call, I know that, but it is on the portal, Nick. All actual reports that we have are available on the portal. I cannot remember at all what actually area they are saved under. If you give me one quick second, I can find out for you. This is definitely one of those because the portal has so much information in it. It's hard for me to remember exactly which area every single item is, but it is definitely there. So bear with me and I'll get that answer to you, Nick. One second. Deb, will you be able to see both pages of the result report on the portal? Well, let's go to the portal. Let's find. I think it's, yeah, it's under, yeah. Nope, that's not it. One second. Yeah, it's under, if you log into the portal, if you go to marketing materials, there is a tab at the top that says sample reports, and you can see all the different reports. You have the sample BRCA, you have tox, you have sample chemo report, sample core DME report, MTHFR report, as well as warfarin. Those samples reports are all there and available to you.
So do we have factor 5, factor 2 reports as well on portal?
I do not see them at this time, but we can definitely get those added. Not a problem.
All right.
Yep.
Yeah, I
Wonderful.
just want to say, if before ending this seminar, if they are still listening to me, I just want to say, I know you guys are in the market. If you can give me suggestions, what tests do you want us to start? The way right now we are working is, we are working close to the toxicology lab. Whatever they are developing, we are trying to develop like related tests, related DNA tests, so that the same patient can come for DNA test as well, and as well as the blood chemistry test. But if you have any ideas, like you can have any demands from your physicians, feel free to send us. We will see whether it's feasible for us to do. I know we don't have proper facility, but we will try. We are trying our best.
Absolutely, absolutely. And I'm actually, just so everyone can see, I'm going to take the screen back here, Varsha. I'm going to make myself the presenter, and I'm going to show my screen. So just so everyone can see where all these reports are for viewing. Again, I'm in the, hopefully everyone can see my screen. Varsha, can you see my marketing screen?
Yeah, I can.
Excellent. This is the portal, as everyone is well aware of what the portal is. I'm going to go back one little click here, if it'll let me click. There we go. Here's the primary area that you come into on the portal. And where I'm into, down here under resources, there's marketing materials on the left-hand side. Click on that, and if you notice the top, right below the header, are different areas. If you click on sample reports, this is where all of them, they're listed on the main one that comes up, but you can filter by clicking on those tabs. And here you can click on sample reports, and you can see all the different reports. And just to make you aware, for instance, here's the BRCA report. If you click on the actual image itself, it just opens it up for you. And it allows you to save it, print it, whatever you need to do. Use your back arrow to save back in the portal. If you click on the wording, one of them actually does display, one does a download. I think I've actually downloaded both of them. So, but one of them actually does one function as downloads, and the other one is just a view. Just remember, you're still in the portal. Use your arrows, because if you click out of it, you're going to exit yourself from the portal. So just really good to remember that. For instance, here's the warfarin one. If you click on it, it'll just open it up for you, again, allowing you to print or save. But mine are both acting a little, oh, here it is, just to view it. So, and just by clicking on the words. I actually have outlined this in the cascade of how to get to this area and how to view those reports and which function does which, because clicking on the image or clicking on the words does two different things. But those reports are here. Another little thing just to point out here, if you're, I know we're not talking about tox today, but this tox report guide is right here and available. This is the one that I talked about, I believe it was 2 weeks ago, that was put together on how to read your tox report. It's right here in this section, making you available, making it available for you to help your clients with that information. So please utilize this. Let me see if there's any more questions here. Let me think here. Jack, great training and showing portal, very good as well. Thank you very much, Jack. I just read out loud before reading anything, so excellent. A couple of things that definitely the portal, I push the portal a lot because there's just so much great information on here. So again, just log in that portal, review this. If you cannot see everything, especially these resources that we're talking about, please let myself know, as well as I believe it's Dan who actually is taking care of this, to get this information visible to you. Another great section on the portal, Forms Library. Wonderful section. You have some individual, again, filter. These are your filters here at the top. Recent images, that's everything that's here. Your ABNs is here, your internal forms. This is just, again, great information that's here. Your EMR request form is here. Interface 101, understanding the interface, how it works. Your genetic consent form is here. Yes, it's also out in the link that's been shared on the genetics page, but it's also in here for your use. I'm sure you all know new client registration form is here. Just a touch base, please use the regular area that a client would use instead of using the form would be really helpful. But again, all those wonderful forms are right here for you at your fingertips here in the portal. So please utilize that. And if you are confused about the portal and not really know where things are, we can do a webinar on that as well to get really down deep into this information. So, but any other questions? I don't have anything else that came up. Let me just look here. Deb, just to touch base, you talked about will you be able to see both pages of the results report on the portal? Just to show you that again, I'm going to go into the marketing materials, sample reports, and I believe Varsha was possibly showing the BRCA at that time. I'm going to click on that so you can see. It actually is a total of 3 pages that you can see on the portal. So let me make this a little bit smaller so you can actually see the report. But it does actually give you all the information that you would need and, again, what the client would be receiving. Okay? So all that information is right there. I believe all of them are the exact same way. Here's the core DME. This one is actually 10 pages long. So this is, again, great information about the test, the results, information about it. Again, just really great information right there at your fingertips. Okay. Any other questions before we leave? All right. Wonderful. Again, you're more than welcome. You can email Varsha or myself with additional questions. This webinar will be available online by end of day, and I'm not going to keep announcing the webinars that they are available on the portal and the Cascade. Just know that that's where they're going to be. As soon as they are conducted, saved, recorded, they're going to be up on the portal within 24 hours, and as well as the presentations. Oh, well, that's a good one. I'm going to say one more thing here. I'm going to go back to the main area where they are. Webinars, clear at the bottom left-hand side. Sales presentations is the sales support at the top. Sales presentations. This is where the actual slides would be. So, for instance, here is the phlebotomy supply presentation is here. But if you go down to the webinars, click on that. Here is the presentation that was done on Thursday. They're not side by side, but they are in their separate folders here on the portal. So just be aware of those locations. Okay? Excellent. Well, thank you everyone for attending. I really appreciate it. And right now, we haven't yet figured out if we're going to be doing webinars next week or not. I do think they are very valuable. If you have suggestions for a topic that you would like us to do on a webinar, even as early as next week, please utilize that feedback that was sent out to the Cascade. Your input, your information is extremely valuable and reviewed every single day. So please take advantage of that. Thank you again, everyone, and have a wonderful day. Thank you.
Yeah,
Thank
bye.
you, Varsha.
Thank you so much. Thank you.
Bye-bye.
Bye.
You're welcome. Bye-bye.